A particularly difficult diagnosis to deal with when you're trying to conceive is diminished ovarian reserve. So after the age of 35, we see that there's a steady decline in egg reserve and follicle count, and it can be accompanied with a decrease in follicle quality or follicular integrity as well. So this may translate to a more difficult time trying to get pregnant naturally or potentially with assisted reproductive technologies like in vitro fertilization, IVF, for example. So I always like to look at what are the other adjunctive treatments that we can consider to help support patients that are trying to conceive and are in this situation. We always talk about, on our research posts very frequently, about certain micronutrients, antioxidants, lifestyle impact on fertility treatment outcomes. A very, I think, undervalued treatment option, which is non-pharmacological, which has been shown to support egg quality and antral follicle count, is actually fertility acupuncture. And a recently published systematic review and meta-analysis that looked at approximately 13 clinical studies and in total about 800 patients, just short of 800 patients, found that including fertility acupuncture, taking into account its very high safety profile, was observed to do some very wonderful things for patients trying to conceive that had diminished ovarian reserve. They saw an increased hormone level of anti-Müllerian hormone, or AMH, which is a marker of egg reserve. They also found that the antral follicle count went up, meaning that patients, if they're going for IVF, if their antral follicle count is higher, there's potentially a higher chance of retrieving more eggs with that procedure as well. And more importantly, they found that egg quality could actually be higher in some of these studies as well. So including fertility acupuncture is such an easy addition because of its non-pharmacological nature. It can be easily combined with various drug protocols for patients, regardless if they're going for IVF, IUI, and in some cases if patients are trying naturally as well. But it can provide, an edge up, a step up in supporting our chances of potentially more positive outcomes if you are considering a treatment like IVF there. And they found approximately three mechanisms which are hypothesized to help explain why we might see this improvement in egg quality. Number one, they saw that they might actually diminish the oxidative stress, may help improve the antioxidant activity in the ovary there as well, and reducing oxidative stress and improving antioxidant capacity is a very vital component of supporting egg quality with low egg reserve. Secondly, they saw that it might actually modulate the gut microbiome as well and may impact levels of certain metals like iron, and that might indirectly affect egg quality as well. And a very important one is they see that it can actually improve insulin sensitivity. Insulin sensitivity is very closely related to oxidative stress, that chemical stress that can harm egg quality, sperm quality. So by improving insulin sensitivity and having more healthy and optimal insulin levels, it may reduce the amount of oxidative stress in the ovaries there as well. And there are other mechanisms by which fertility acupuncture has been hypothesized to help improve the success rates that they see in studies, but these are three important ones that might help explain why fertility acupuncture may actually help support egg quality for patients with lower egg reserve as well. So if you are trying to conceive, in addition to working with your fertility clinic and looking at what is the most optimal drug protocol for you, looking at lifestyle and preconception care in terms of what micronutrients, antioxidants, other treatment options that may help improve egg quality, fertility acupuncture should be on that list, and you should be having a very detailed and healthy conversation about including fertility acupuncture, but more importantly, including the right fertility acupuncture. So we see there's a vast number of protocols that can be done. There's hundreds of acupuncture points, so the number of protocols can look very diverse. So you want to make sure you're getting an acupuncture protocol completed or in your treatment plan that has actually been studied to help support egg quality for patients with low egg reserve.